Greetings. This is Kyle and Garrett coming to you, introducing the dietary supplement Coenzyme Q10.
So what is coenzyme Q10? Coenzyme Q10 is a vitamin-like substance which is naturally occurring in the human body. This is also called coenzyma or ubiquinone. Coenzyme Q10 is an antioxidant that your body produces naturally. Your cells use coenzyme Q10 for growth and maintenance, and levels of coenzyme Q10 naturally decrease with age. These have also been found to lower with such conditions as heart disease or those who are taking statins. It is naturally also found in meat, fish, and whole grains. The amount of coenzyme Q10 depends on dietary sources, but there isn't enough to increase levels in your body through the dietary. So you can supplement that to rapidly increase the coenzyme Q10, and this is usually taken by tablet, but could be possibly by IV. It's especially helpful with certain heart conditions as well as migraines, and also been seen effective in Parkinson's disease.
What are the effects of coenzyme Q10? Well, it increases the mitochondria's ability to produce ATP by allowing the mitochondria to better use macromolecules. With this, we will see a decreased blood pressure that is not exactly known through studies, and we will also see a decreased blood sugar, and that makes sense because our mitochondria's ability to use the macromolecules more and more efficiently will in hand reduce the blood sugar.
So who would use coenzyme Q10? So it is not exactly approved by the FDA, as all herbal supplements typically are not, but it's mainly used for older adults or those suffering from diseases such as AIDS, MIs, Alzheimer's, cardiomyopathies, cardioprotections following surgery, congestive heart failure, hypertension, migraines, Parkinson's disease, and renal failure. And while studies have not specifically indicated the physiological effect of CoQ10, it is believed that these diseases, macromolecule metabolism is decreased, and CoQ10 will increase the metabolism of these macromolecules. During these diseases, their energy is not able to be metabolized as well when they are sick, and CoQ10 can increase that, overall increasing the ability of the cells to use energy.
What are the side effects, adverse reactions, and warnings that come along with coenzyme Q10? First and foremost, if you have an allergic reaction, you get hives, or if you overdose, it is possible you should receive or go get emergent medical attention. Biggest side effects possible, you have shortness of breath, swelling in the face, and nausea and vomiting can occur. Also be careful with blood pressure as it can drop rapidly, causing fainting. Blood pressure should be checked periodically while on coenzyme Q10, and patients should be aware that they should stop taking the drug 2 weeks before any surgical interventions, and that a physician should be advised if a person wishes to take the drug while pregnant. Also note that coenzyme Q10 reduces the effects of warfarin, which would lead to a person being more coagulative venously or blood-wise.
Some other drugs which have a similar effect as coenzyme Q10, similar to beta blockers in that both will reduce that blood pressure, which is a warning we had. You have to be careful if you're on this drug, it doesn't drop too rapidly as fainting could occur. It's also similar as to creatine and B complex vitamins, as all three drugs will enhance mitochondria ability to metabolize macromolecules. So this is more evident in coenzyme Q10 as overall function of the cell, whereas creatine is more evident in physical performance functioning, as this is not indicated with coenzyme Q10 but is in creatine.
Mayo Clinic did some research for us in referring to coenzyme Q10. As far as heart conditions, coenzyme Q10 has been shown to improve symptoms of congestive heart failure. Although findings are mixed, CoQ10 may help might help reduce blood pressure. Some research also suggests that when combined with other nutrients, CoQ10 might aid recovery in people who'd had bypass and heart valve surgeries. With Parkinson's disease, early research suggests that high dose of CoQ10 might be beneficial for people in early stages of this progressive disorder of the nervous system that affects movement. With statin-induced myopathy, some research suggests that CoQ10 might help ease muscle weakness sometimes associated with taking statins. Referring to migraines, some research suggests that CoQ10 might decrease the frequency of these headaches. And with physical performance, because CoQ10 is involved with energy production, it's believed that the supplement might improve the physical performance. Research in this area has produced mixed results, however.
So if a family member asked if I would recommend Coenzyme Q10 to them, I would if they were an older adult or if they were on a statin medication, as both of these age and statin medication decreases the natural amount of CoQ10 in the body. So this supplemental amount could help increase that and increase the production or increase the ability of the mitochondria to metabolize the macromolecules. I would also let them know that if they were suffering from any of the previous stated diseases, that could be another benefit of taking it. And I'd also let them know that it's a pretty cost-effective drug. We saw that most were about $25 for 3 months worth, so it's pretty cheap and has little contraindications or adverse effects. So as long as they're not having any of those blood pressure issues or low blood pressure, then I would say that Coenzyme Q10 wouldn't hurt to take and is pretty effective in increasing the ability of the cells. So thanks.
Yeah, thanks.